everyone. Welcome to our podcast on postpartum care. My name is Maria Jimenez, and today in this episode, I'll be talking about postpartum care in the U.S. healthcare system and how factors like zip code and income level influence the quality of care new mothers receive, especially among the marginalized communities. To explore this topic, I spoke with two professionals working directly with postpartum populations in New York, each offering a different but equally important perspective. First, I spoke with a nurse practitioner who works closely with low-income patients. They shared their experiences providing postpartum care on the front lines, including the barriers many women face when trying to access consistent and comprehensive care after childbirth. Thank you for joining us. Can you tell us a bit about your background and patients you've worked with?
I've been a nurse for over 10 years. I'm a women's health nurse practitioner for over 8 years. I served underserved women, which includes people from different ethnic backgrounds, mainly the Irelands, Mexicans, Haitians, Trinidadians, Bajans. I do care throughout the lifespan. So from 13 years old up, I do gynecological care and obstetrics as well.
Okay. And you're based in New York, correct?
Brooklyn, New York.
How long have you been working with underserved communities?
8 years.
8 years. And from your experience, what does typical postpartum care look like for your patients?
So it all depends on the type of delivery that they have, right? Mm-hmm. So if it's vaginal, it's at 4 weeks. If it's C-section, it's normally 1 week for wound care and then 6 to 8 weeks for postpartum. Either way, it involves a lot of teaching as far as birth control, breastfeeding. We have to assess the patient to make sure they're not high risk for like blood pressure disorders. And if they have any food insecurities, we'll have them sign up for like WIC and food stamps. So it's very like detailed.
And for WIC and food stamps, do majority of those women, are they able to access that, or is it just limited to certain women? Everyone?
Yes, because majority of all patients that I serve is on Medicaid.
Okay.
So yes, they're eligible for it.
And then what are like the most common health concerns you see in postpartum patients, both physical and mental?
So physically, they don't get as much help at home as needed because this is underserved population, so they don't have really a steady income. So if they do have a partner, the partner has to go back to work. So they're really alone at home with the baby. And mental, what I've realized is Caribbean women or Caribbean people generally, they do not think mental health and postpartum depression is a thing. So they try to ignore it and they try to push it off when truth and in fact, it's really something that they can actually get care for and it's something that really exists and there's medication for it.
I have realized that a lot of people, as well as, for example, the Latino community, they also think that depression isn't a real thing. And how do you spread the information that there is hope for that?
Just because I feel like patients really listen to me more because I'm from the Caribbean. It's not like I'm Caucasian and I'm just looking down at them. I tell them, listen, I'm from the same place you're from. Like I experienced postpartum depression with my first baby. And it's a real thing and there's help out there. And it's not like nobody's going to label you crazy. Nobody's going to look at you differently. It's all part of the hormonal imbalance that could happen. And there's help out there.
You mentioned you experienced postpartum with your first child, correct?
Yes.
When did you decide you needed help?
When I realized that I didn't want to see my baby, hold my baby, I realized that, my depression was taking over and this is supposed to be like a joyous period,
Yeah, a lot of people do go through that, especially when they're not aware of like all the resources are available for them.
Right.
And having that person, that provider that they trust in does really make a difference. Like you said, they really do trust you. So they listen to you, they listen to your advice that, you know what, like I'm not crazy, like I do need help.
I also so the bond doesn't start at postpartum, right? So the bond started from the time they were pregnant. Yeah. We develop a relationship because they come in a lot of times for their prenatal visits. We talk, we have a relationship, we talk about regular stuff. It's not like I'm very personable. So it's not like you just come in, okay, come back in 2 weeks, we listen to the baby, you leave. How's your day? How's everything? What's going on? They let me know what's going on.
Yeah, that's good. that you have that connection between your patients.
Yes.
And have you noticed if postpartum has changed throughout the years?
I did, yes. I feel like now there is a movement to help Black women decrease the mortality rate because they've realized that there's increasing mortality and morbidity when it comes to Black women in pregnancy and postpartum with like depression and suicide. And so I feel like there's more care. Like recently they actually developed a pill that you can take for 2 weeks during the postpartum period for postpartum depression, and it helps. And that was not available before.
Oh, so it's like a new pill that they just came out with? Okay, I didn't know anything about that either.
Yeah, it's a new pill. I forget the name of it. I think it starts with a Z, Zulane.
And does any woman going through postpartum get that pill, or is it only for a specific woman?
It depends. They would have to be evaluated by a doctor. Anybody that's experienced it can definitely get it. The only setback or the problem is Medicaid doesn't cover it and it's expensive.
Oh, okay. So not even if you guys
It's not
do have it,
accessible,
it's
right.
not accessible.
Yeah, but it is available, you know?
Yes, yeah. I feel like that's a problem a lot with medication too. Like we could have it, but it's not available for everyone.
Right. Yes, absolutely.
Yeah, and that's a struggle. And in your experience, how does a patient's zip code impact their access to postpartum care?
It depends on where they live, the type of hospital that they're close up to, and the type of care that they're going to receive. And also the type of zip code that they live in, if they don't feel comfortable or if they feel like they're being judged by their healthcare provider, they're not going to go to their appointments.
Oh yeah, that bond between the provider and the patient is really important.
Yes. It makes a big difference.
And what's something that stood out to you the most between a higher income patient and a lower income patient?
They have more accessibility to care. So the higher income patients, they will be able to get the best breast pumps and they'll be able to maybe attend, they could pay for classes like birthing classes, whereas the lower income, they may miss appointments because they don't have time off from work. They have to go to work to make money. And they're not financially stable to get the same thing that the high income patient will get.
And for lower income patients, I know that some either hospitals or clinical settings, they offer transportation for help in case they do need it. Do you guys offer anything like that?
No.
Okay, so they would just have to like figure out how to get through transportation in order to get to their appointments.
Yes, like there's buses and stuff. Unless they're like disabled, it's not available.
Okay, and do you think the current healthcare system provides equitable postpartum care?
I think so, because I do. So I could only speak on what I give, you know.
Yes.
I think NYU, the organization that I work for, I think they do offer equitable care. I don't see any bias, so I can't speak for any like New York healthcare system. I mean, they try to promote that, but I can speak for NYU.
Okay, and when you see a patient who cannot afford or access the recommended care, how do you navigate through that situation?
There's a referral for family services. So I put that referral in. Or we have on staff insurance coordinators. If they're uninsured due to immigration or other issues, they can give them PCAP, which is like a free insurance for pregnant patients.
For that free insurance, do they have to like pay a minimum? Or no, it's completely free.
It's anything that deals with the baby, prenatal care and postpartum care and delivery is all covered.
That doesn't include postpartum, correct? If the mom is going through
it does.
It does? Okay.
So it's not going to include like if they have depression, like it's not going to include the pills that we just discussed.
Yeah.
It's going to include like postpartum care itself.
Okay, that's nice. I have never heard about that either.
Yeah, PCAP.
Pickup?
New York State offers that. PCAP, PCAP.
Is it only based on New York? No one else offers that?
I think it's only New York.
Only New York?
I think so.
Okay.
Yeah.
Yeah, that's really interesting. That's something that would help a lot of people in other states as well. And do you see disparities in access to mental health support for postpartum patients?
Yes. I mean, I feel like it's not really access to because we have that here. It's them accepting the fact that they need it. Right? So they don't see mental health as being an issue. They think it's just something that they will get over. or they will pray about it.
And if they do realize that mental health is important, but they lack the money for it, what concerns go through those untreated mental health?
I would send them to the ED. I don't just let, like, if I feel they're depressed or they would do possible harm towards their kids or themselves, ED, send them to the ED. They're not going to turn them away. Let them assess them and let them see if they need additional care.
And even if they don't have insurance, they won't turn them away? Or they would?
No, you cannot. There's like a law. You cannot turn anybody away. I forget which act it is. But insurance or no insurance, they do not turn you away.
Okay. Is there like any changes you would like to see in the healthcare to improve postpartum care?
I feel like it should be more easily accessible. Like for us, for example, when you deliver, you come back at a certain time, like 4 weeks, 6 weeks. What I tell my patients is if you don't feel okay, if you feel like you're stressed out, if you feel like you're losing it before that 4 week period, you come back and see me. Like it doesn't have to be at that scheduled time.
Is that something you see often where a lot of women are coming back to you before that 4 week period?
No.
Is there like an example you can give us from your practice of a situation you've seen that you weren't able to do much on, but just recommend resources?
Let's see. Or a patient, she couldn't, she wanted resources. She wanted to know if we were giving away free car seats. We were not. So I referred her to different places. I referred her to family services. I referred her to other places to see if they would be able to help her because financially she couldn't afford one. And there was nothing else I could have done. Like insurance company doesn't pay for that, you know?
No, yeah. Well, that's good that you guys have the extra resources to send them
Yeah.
somewhere where they could receive the help. And are there programs you guys have or like policies that have been effective in reducing disparities?
We just, we promote equal care to everyone. So it doesn't matter, no insurance, whatever insurance you have, even if you come in and you don't have insurance, there's a sliding scale. You show them proof of income, and some people pay $17 for a visit, which is nothing. It's less than $20, and you get full care.
And that's with a type of insurance?
Yes, no insurance.
No insurance.
Yeah.
Okay. So what I've heard a lot is that you guys offer plenty of help with uninsured people. A lot of patients don't have insurance, and you guys still treat them. So you guys don't turn them away based on
Yes.
they have or do not have insurance.
Correct.
And that's only for where you work.
Yeah, so with you do not get turned away. Insurance, no insurance, whatever type of insurance, there's a bill from the state that you kind of turn away a patient.
Since not everyone gets turned away, is there big wait times, or like are you guys overpacked with patients?
Not all the time, because not every day. So you're not going to have the same amount of walk-ins every single day. But yes, there is different times that there may, not for me, like you may wait 30 minutes to see me, but for example, Vidiana, sometimes people wait 2 hours to see her, but we're different, right? So she's medical and I'm GYN. So whereas somebody walks in for vaginal discharge, somebody could walk in with her for like a headache. And so it's more detailed and more. So it all depends on the profession. So sometimes she would have a longer wait time than I do.
Okay. And what do you try to support families with who face these barriers in your practice?
I at least help them with like food insecurities, refer them to pantries. I refer them to free mammogram services if they don't have insurance, because sometimes a screening mammogram is $500. We have different resources.
And is that just a limited amount that you guys offer, or is it specifically only for people who cannot afford it and really need one?
It's people with no insurance.
No insurance? Okay.
But if you have insurance, it's covered.
And it's not limited for a specific amount of people, correct?
No, it's not.
And can you explain what a day-to-day for a mother and baby looks like when they're uninsured or they don't have that support that is recommended to them from family or even friends? How do you know that they're being affected?
They would come in and they would tell me that they need an updated WIC form, the baby milk is running out, or if there's any other agencies that is giving like free Pampers, or if they're eligible for food stamps. So they would come in to tell me, like they would just make appointments for that sometimes just to tell me, and I try to help them.
And if none of these problems were addressed, obviously they wouldn't be receiving any of the help.
Correct.
I know it. You can't speak for others, but do you know if it's something that all the providers there provide? Like they do inform every patient, or it just depends?
It all depends. Everybody's different. Not everybody cares like that.
Okay. And what is ethically important that all mothers have access to proper care? Why is it ethically important? Sorry.
It's important because you want to make sure that you and your baby is getting the right care, the right vaccinations. Make sure your baby is healthy. Make sure you're healthy. Make sure your blood pressure is normal. Make sure your mental health is okay, so you're not at high risk for like suicide and self-hurt or you hurting your baby. It's important. It's very, very important.
Yes, I agree with that. How can we, as the listeners, like the community members or even policymakers, help make care more accessible for postpartum?
I feel like they need to promote it more. I feel like education is important
Mhm.
because some mothers, if they're not educated, if they don't have a high school diploma, if they never went to school, they don't know how important your blood pressure is. They don't know how important having good nutrition is when you're pregnant. They don't know. So I feel like with education and like letting them know how important it is, it would help. And how do you recommend we can spread this information? Like, how can we promote the help? I would say ads, pamphlets, when they come in for prenatal care, you counsel the provider as far as what to say and how to educate the patient so they can come back also for their prenatal care and also bring the baby to the pediatrician. Okay, that's what we're trying to do a little bit based on our podcast on our group where we each have different topics, and right now we're just trying to spread more information about it because we thought it's something that many people are not aware of or they lack the resources or they think that they're alone, and we just want to let them know that they are not alone and they have help that they can go to. Yes, it's very important just for education purposes. What is some advice you would give future healthcare providers about addressing inequities in care? Be more open, don't be judgmental. um Educate your patient according to their education level. You can't speak to someone who's never went to school. You can't use big terminologies. You have to like explain it to them in like fifth grade language so they would understand and they would get it and they would likely to listen to you if they feel like they have a good relationship with you. And you told me you do have good relationship with your patients. How many patients do you see within a day, like regularly? 25, you said? 5 to 35, yes. 25 or 35 a day? A day, yes. Okay, so you do see quite some patients. I'm very busy, girl. Yeah. So I really thank you for having the time to be able to do the interview. I wanted to see how different it is from having care in New York based compared to Phoenix. I have seen a lot of difference actually. You guys do offer more help with uninsured people, and right, you guys do have like free insurance. Here you don't really see that much. What I do know is that they sometimes offer transportation, like your insurance would cover transportation if you can't get to your appointment, so they'll send you transportation to your house and then to the clinic and then back to your place to make sure you're safe. But that's pretty much all I've heard about. That's it? Okay. Wow. I haven't heard much about all the help that you guys offer, all those resources and all the insurances. And even like the pill, I'm not sure if it's something that they have here right now. Yeah, I mean it's FDA approved, so it's there, I'm sure. But again, if it's Medicaid and those low income insurances, it's not gonna cover it. So yeah. And have you seen anyone that's uninsured try to actually buy that pill? No, they don't even try. As long as you have to pay for it, they don't. They rather buy baby formula and like Pampers than buy that for themselves. Okay, so they put the babies first before them. Yes. The moms. Yes. And would you say that should be something more accessible, the pill, instead of just making it for high income patients? I would say yes, but that's the manufacturer. Like I guess for them to actually have a pill that works and you only take it for 2 weeks of the postpartum depression period, I think that's amazing. And I feel like they're probably trying to make their money back from all of the research that they did. So that they don't want some change for it. I believe if they were to
provide the new medications that they come out with to lower income people as well, it would greatly benefit both sides because more people would be able to buy it or more insurances would be able to cover it, and they could probably maybe make even more because they know more people would be into it or actually getting that help.
Yes, I agree. I do agree. But I feel like maybe if other providers request it for low income patients, then they may, but not everybody's on the same page.
And I just wanted to say again, thank you so much for
Oh, you're very
sharing
welcome.
your insights and experiences. It really adds on to important clinical perspectives to our discussion on postpartum care and health disparities. So we really appreciate your time and your expertise.
Thank you so much.
What stood out from that conversation was how deeply access to care and lack of resources can shape a patient's postpartum experience. To build on that perspective, I also spoke with a behavioral health therapist, also based in New York, who works with individuals navigating mental health challenges. Their insight highlights how these systemic barriers don't just affect physical recovery, but also emotional and psychological well being. Hi, thank you for joining us. Can you tell us about your background a little bit and what area you work in?
Yeah, absolutely. I'm a clinical social worker, licensed with my master's social work. I work in a health center in New York, providing short-term outpatient therapy to patients of the clinic and of the community who are referred by their primary care providers for different reasons. Could be a new medical diagnoses or, postpartum, as well as if they score high on anxiety or depression screening, such as a PHQ-9 or GAD-7. That's what I'm doing now. My background is I have a bachelor's in psychology and have done a lot of nonprofit work accompanying different immigrant populations in various different states in the United States.
That sounds all really interesting. How long have you been doing all this for?
So I've been working at the health center for about almost 3 years now. But I've been working in more kind of social services with different immigrant communities since after undergrad. So it'll be about maybe, six or 7 years now.
Okay. And do you believe there's like a difference where someone lives, like their zip code, difference between the rural areas or urban care?
Yeah, absolutely. I do think so. I think your zip code definitely makes a difference in the type of care that you have access to in terms of, I can speak a little more to the mental health side of things and access to therapy and behavioral health services. I know too, working in a primary care setting, I work a lot with physicians and primary care providers, and I'm hearing from them as well. That is the case that where you live does have a huge impact on your health because it also impacts access to food, right? If you're living in a food desert or if you have access to many different types of produce and local markets versus not having access to as much food options as well.
And when they don't have that much help, they do offer like WIC help. Do you think these programs help a lot or do they somehow fall short in helping?
I would say they help, but always, especially a lot of the communities that I work with or have worked with in the past would benefit from more comprehensive support. So WIC is, I think, definitely helpful and needed, but there's certain limitations that I think other different social services or an expansion of WIC could maybe help with.
Oh yeah, and you had mentioned that you worked a lot with immigrants, like the
Mm-hmm.
immigrant population. Um, what are some common barriers that you see they face?
Yeah. Yeah, well, I would say, yeah, your immigration status, especially in this country, has such a big impact in what types of social services and even jobs that you have access to. So I think, especially with the patients that I work with, I've seen, certain employers, because of immigration status, sometimes take advantage of the fact that, people are working jobs that are quote unquote kind of under the table, or even though they are still paying taxes. So your immigration status really impacts your access to different social services, even different types of ability, like upward mobility. So able to access, higher education, and access to different scholarship opportunities, even the FAFSA. I see it across, I think, the age, the lifespan, really. Say that.
Yeah,
The case, definitely.
yeah, I feel like we have been facing that a lot recently, of
Mm-hmm.
offering help or finding different ways where we can help them out in those situations. And I feel like community itself helping is
Mm-hmm.
means a lot. You had also mentioned that you've worked with postpartum patients. How many patients do you often encounter with these mental health concerns?
Yeah, so there's a couple OBGYNs that work in the clinic, and so sometimes they'll refer their patients over to me. Typically, I will see about, 3 or 4. There definitely is many more that get referred to another clinic. So that's not to say that they're not there and in need of services, but only a few of them come to my care. But I would say there's a lot of different factors that impact their access to care and mental health. Again, I think immigration status of a lot of patients that we see at the clinic, what supports they have in the United States. I think a lot of the patients we see, a lot of their primary supports might be in a different country, which makes it difficult to have kind of an established kind of quote unquote village to help them prepare for the birth, and then after birth, make sure that they have childcare. I think that there's a lot of barriers for some of the patients that we see at the clinic.
Have you ever came across with someone that has denied all this help due to them being scared that they'll be reported, or that they don't understand all the help that there is, or because they don't want to accept that they're going through postpartum depression?
Yeah. Actually, I saw a patient who, she's not postpartum, but previously she mentioned that her primary care provider had initially referred her for behavioral health therapy, but she didn't end up. This was with a different provider, a different therapist, sharing kind of all that was going on with her symptoms and her depression, due to fear that, or kind of misunderstanding that if she did report that while she was postpartum, they could take away her baby, even though she was perfectly capable of, in a okay state to take care of her child, but I think had heard maybe things through social media or through other people's experiences, and had this fear that if she were to really share all about her symptoms, including kind of sometimes low motivation, that would be a reason for, child protective services or someone to take her baby away from her. So I think it absolutely does come into the mind sometimes of certain patients of whether they want to accept behavioral health care.
And do you know by any chance if this mom had help from either the husband or family members, or was she a single mom that was scared that if they considered her being in that postpartum depression, she would definitely get taken her baby away just because she didn't have that extra help?
She has a spouse, but aside from that, I think not much other family in the area.
Okay, and in this case that she turned away the help just due to fear, is there anything else you guys can do, or like you guys provide extra resources, or does she just go home and have to deal with everything going on by herself?
Yeah, so this was in 2020. She had happened, I guess, in the past. But she actually was able to get access to care to the therapist. But I think at the time still felt worried about fully sharing all that was going on in her life and like symptomatically, because not knowing what the implications of that would be in terms of remaining with her child. In terms of the clinic I work at with some of the different family health centers, there is a Healthy Steps it's called Healthy Steps. It's a program that it's grant funded, provides care or kind of like care management with different social workers or other licensed practitioners to meet with new moms or young teen moms to kind of help see if there's any resources that they need. They usually catch these patients during the child's first well visit, the baby newborn's first well visit. So that's a really great resource that I think some other health centers have. I believe it's a national grant that some other clinics have in the nation.
Yeah, that's awesome that they do have resources that they can go to and you guys can offer, so that way they don't feel that they're alone and they don't have any help.
Definitely.
And are there like any warning signs that are often missed, or key signs that we the people should look out for?
I think often it can present like other symptoms of depression, social withdrawal. So if, you have a loved one that recently gave birth that is starting to, be less responsive to maybe messages or social gatherings, it's possible it could just be exhaustion if their baby is not sleeping through the night. But if it starts to become a pattern and you're really not seeing them very often, then it could be a good time to just check in with them and see how they're feeling. So I think social isolation, if you're living with this person or closer with this person and noticing that they're kind of not having motivation to do certain daily tasks, like kind of take care of their hygiene, that's maybe another concern. I think it depends on what kind of closeness you have with the person, if you're living with them or if you just see them more occasionally.
Yeah, I feel like everyone should be checking up on their friends, their family members. Even offering a little bit of help means a lot to them too. It's like, oh, definitely. You know what? Go grab a coffee, go out to eat dinner, breakfast, and I'll help you take care of the baby. I'll even help you clean the house, if anything. Things like that mean a lot to a mom, or
definitely.
a recent mom, especially.
Definitely.
In some cases, like, how would you tell the difference between postpartum depression, lack of readiness, or unplanned pregnancy?
Yeah. So I will say I'm no expert on this topic, but just to disclose, but I think in general, if it is a first pregnancy or there's not a lot of social supports, it's important that the primary care provider of the new mom and also the pediatrician are screening for these things, as well as the OBGYN. And they have different objective measures that they can use to just check in, make sure that the mom is not going through postpartum. That's pretty standard. I would say there's some standard tools that are used to screen for postpartum depression, especially right after birth. There's one screening that's very common. Edinburgh postnatal depression scale is a really common test that's often administered by OBGYN or other mental health provider, usually on site on clinics, so they can kind of distinguish and use those tools to help.
And those screenings, you did mention that they're done afterwards, but do you believe that it can start before birth, or is it only after?
Postpartum does kind of signifies it would be after birth, but there absolutely someone can have symptoms of depression during a pregnancy, before a pregnancy. That absolutely can be the case. I think postpartum in itself, and again, I may need to fact check myself here, but is something that's typically diagnosed after birth, given the post.
Yeah.
But again, that's not to say that a mom can't have depression during the pregnancy or in the early stages during the first, second, and third trimester.
No, yeah. The reason I asked the question was that some moms are just scared that they may fall into it, or that they're not ready. That's why I had asked the question if it could happen before, because maybe they're accepting the fact that they will need help, but they're trying not to sound like if they don't want the baby at all.
Like anticipatory anxiety or worry about seeking care, mental health services after the pregnancy or after birth?
Yes.
Yeah, in certain, smaller social groups, we see patients from many different cultures and backgrounds. There can be a lot of different beliefs about mental health, and accessing mental health after giving birth too. There can be certain stigmas, I think, attached with that. It's important to catch that in a medical setting to normalize that postpartum period, and the many different changes in hormones that are going through a woman's body during and after birth.
No, yeah. And sometimes people don't accept depression. It's a lot of a cultural thing. I had mentioned in a previous interview, I believe, that talking about the Latino community, they don't really believe in depression. They think it's something that shouldn't be considered important or should be going to the doctor for, because if you do, then they basically call you crazy, because you're not in like a right state of mind, you can say. That's what they would see it as. But also for moms, when they do have their babies, sometimes the husbands don't believe in that postpartum. Do you think that there's resources for husbands or men in general that can help them realize or get more information about postpartum and accept that sometimes new moms can go through that? Not, it doesn't mean that every single mom is going through the same thing, but majority of them will sometimes suffer of postpartum.
Yeah, it's a great question. I think, again, in an ideal world, a mom would maybe be, or an expecting mom would maybe be accompanied to a medical visit by their partner or another family member. I think it really depends on the population and socioeconomic status, because I think often, the other partner really has to work, and it's difficult. There are jobs where it's difficult. Again, this is a little bit of a generalization because every situation is different. But they may be jobs where they're less able to take that time off to attend prenatal visits. So I would say in an ideal world, this information could be shared at a medical visit with the husband or other partner, and family member who may not know as much about postpartum, period. There are resources I know online. Postpartum Support International is a organization that has some different availability to. They have a hotline in Spanish, actually, and English. I don't know if it is in any other languages, but I know they have a hotline in English and Spanish. If someone believes that they're experiencing symptoms of postpartum, and they have another line where you may be able to learn a little bit more about postpartum on their website.
Okay, we'll definitely look into it as well, just to share out more information and have the community become aware of it. I feel like the more information we spread, the better it is, the better we will help future moms, current moms.
Absolutely.
And out of the patients like you've seen with postpartum that come to you, what's like the longest you could say they last in this like in this depression state? Like, is it almost the same as depression in general?
So I can only kind of speak from my experience. I only provide short-term therapy up to a few months. Okay. So if their symptoms aren't improving, I would refer them on to care. Okay. So I can't exactly speak to what that difference. And I think each patient too is very different. It's really depending. There's so many factors that can influence that, like access to social supports or, whether there's domestic violence involved, or other insecurities for food or housing. So I think there's like a lot of factors that impact how quickly someone recovers.
Okay, and low income community, do you think they have the insurance to help ask for these resources? Or what if someone isn't insured? What do you guys do? Do you guys still offer them help, or what do you guys like turn them away?
Yeah, so I can only again speak to the clinic I work at, but again, usually WIC can be helpful, and I'm not 100% sure because I actually don't deal with, or I don't kind of deal with the insurance piece of things, but I know our clinic will do different payment plans, or sometimes can work with patients who don't have insurance or who are underinsured. So I think that looks very different at, I mean, what state you're in, what city you're in. I don't know if someone, like if the same options would exist for someone who maybe lives in a small town in, let's say, Arkansas. So I think at least in the clinic I work in and other health centers, sometimes there are a little bit more supports for folks who are underinsured or uninsured.
Okay. And talking about uninsured, I had spoken to nurse practitioner, but she had mentioned that they came out, I don't know if it was recently, but with this pill for postpartum depression. I'm not sure if you've heard anything about that. It's something I didn't know about until recently.
Yeah, I've never heard of it.
Okay,
actually, myself.
I wasn't sure if like everyone knew. I know that not everyone could get access to it, so it mainly benefits higher income patients because they would be the ones that are able to buy it, since I believe not even any insurance would cover it, so it would have to be a out-of-pocket medication.
Okay. Yeah, I've never even heard of it myself.
Okay, I just wanted to double check if you knew anything about it.
Yeah, I do not.
And is there any any concerns you have about disparities in postpartum care?
Oh, absolutely. I think a lot of what we've been talking about. I think your zip code, your race, your ethnicity, your legal status, what language you speak. I think there are many different factors that impact access to postpartum care. Yeah, absolutely.
What are like some changes you would like to see in regarding to that healthcare system?
Wow, that's a big question. I mean, so many changes. I think a lot of could be a conversation for a whole new podcast. But I think, I think really a lot of the U.S. healthcare system is for profit, and so that makes it hard for folks who are underinsured or uninsured or of certain, status or identities to get access. So I don't even know where I would begin, but I think I can just answer that by saying, I think there's a lot of different changes that could be made.
Oh yeah, sorry about that. I know it was like a really big question, but okay. I feel like that's something that everyone really wants to know, like, or doesn't always agree on about how it works and how they would like to see changes and what we can do to make those changes happen.
For sure.
And is there any advice you would tell students or future providers about what we should understand about postpartum care that isn't always taught?
Another big, good question. I think really just asking new moms, what is their support? Do they have any support, right? And if they don't, if you're in a position to be somewhat of a support, offering that, if it seems like, more professional help is needed, looking up, you can always call, or anyone can always call 988 and request. Not only is it a crisis line, but it's a resource line. So you can request a list of clinics, behavioral health clinics in your area, just sharing your zip code with them. And so I think really just asking someone how they're doing because I think there's a lot of pressure to just be excited and joyful after the birth of a new baby. But there's a lot of changes that are going through a woman's body hormonally and sleep deprivation. There's so much going on. So simply asking how they're doing and offering yourself or, if needed, professional support.
Yeah, I agree with that. A lot of people just pay attention to the coming of the newborn. Like the family gatherings would be just to come meet the baby, come see the baby, but no one really worries or thinks about the mom. And it's something that we should also pay attention to, not just focus our whole attention to just the baby.
Absolutely.
And I just wanted to say also thank you so much for being able to participate in this interview and sharing your knowledge and experiences with us. It was, I believe, really insightful, and I really appreciate your time.
Yeah,
those were
my pleasure.
All the questions I had for you today.
Perfect. Well, I'm glad I was able to connect, and it's a great, important topic that you're doing this on.
I believe this conversation was great. I learned a lot from you.
I'm happy to help.
Together, these perspectives highlight how postpartum care extends far beyond a single doctor's visit. From clinical support to mental health services, access to quality care is deeply shaped by systemic factors like income, location, and available resources. Addressing these gaps is essential to improving outcomes for mothers and their children across the U.S. Thank you so much for tuning in to today's podcast. I hope you join us for the next episode.